So low back pain affects most of us in our lifetimes, and whilst it can be very painful and can be very debilitating, it's rarely serious, and in the vast majority of cases it gets better. It can take a few weeks, but it does get better.
We are Witty, Pask and Buckingham, chartered physiotherapists in Northampton. We have been the leading physiotherapy clinic in the region for 40 years. We treat bone, joint, muscle, tendon, ligament and nerve issues all over the body. Using manual and manipulative treatment techniques, shockwave and exercise regimes, we work to get you back to full health as quickly as possible.
Your spine is stronger than you think. Whilst it can be very painful, most instances it's down to a simple sprain or a strain of a muscle, much in the same way as you would sprain an ankle. It has the same structures about it, so they do get better in the same way, although it does often feel like it's the end of the world. The key, according to most of the research and the experience, is to keep it moving. Keep everything ticking over, keep the muscles strong, keep everything active throughout the time we've got the back pain, and that's the quickest way to get it better. I know now that actually rarely does any of the problems in the back require a scan, because they get better anyway, and often the scans can be quite misleading, and so treat it, work on it, and they get better. With all the research, what we also know is that you rarely need a scan, and rarely does back pain, however painful it can be, does it actually end up in surgery. It's common to have pain in the low back, it's common to have pain down into the back side and down into the leg and down into one side. And often if you've got burning and pins and needles and sometimes weakness in the one leg, that's okay and can be part and parcel of it. Yes, you've got to treat it properly, but it's relatively normal. However, if you're starting to have problems where you have pains in both legs, particularly going down low down in both legs, you're having problems with frequency or urgency going to the toilet, or you get numbness down between the legs, that's actually the time to go and get checked out. But we do have a series of exercises which we're going to go through now, which help most people with most mechanical type of back pain. Be careful with them, don't force them, don't push into sharpness or into blockage, just ease your way through it and that will help. So this exercise is called rotation in line. You need to lay on your back and bend the knee up of the side of the back that is most sore. If it's very central, you can do both sides with this exercise. Then you bring that bent knee over your body towards the opposite side and move your hip underneath you whilst keeping your upper back and shoulders flat on the floor. You can hold your knee with the opposite hand to help bring it over. The key is in getting the hip as far under you as possible there. You then twist the lower back into the soreness. It will feel sort of nice in a painful way, stretching those tight structures out. You might get a click or a clunk, don't worry, but equally, don't force things. If you rock gently at the end of range for around 30 seconds and then roll back, repeating 3 times, several times a day. So the self-stretch to the side. Stand with your back to the wall and your heels around a foot away. Tip your pelvis backwards to flatten your back against the wall. That's not forwards, which some people get a bit confused on that. It's not in that direction, it's definitely flattening your back backwards, tipping the pelvis backwards. Keeping the back flat on the wall, tip to the side, away from the pain to stretch out those lower back muscles on that side. You can reach the arm on the stretching side above your head, and again, don't force into pain. You may find that in this point, tipping forwards and turning helps to hit the spot, as it were. Fiddle with the movement to work out the angle that works best for you. 3 lots of 45 seconds. So this is a simple pelvic tilting with core contraction exercise. You lay on your back with your knees bent, and you place your fingers on your hip bones and your fingertips just into the muscles on the inside of those hip bones. You then gently and slowly contract the muscles in your lower tummy. This is a simple engagement rather than a full-on tensing. And you should not get a lot of tension in your central tummy muscles. It should be just a gentle contraction of those muscles. Whilst keeping those muscles gently tense, tip the pelvis down to flatten the back towards the bed. Hold for around 30 seconds. Then tip the pelvis up to hollow the back, keeping the muscles tensed again throughout. Hold for around 30 seconds again, and repeat 3 times in each direction, several times in the day. So if it doesn't settle, we need to look at other reasons behind it. Even after giving it a couple of weeks of those exercises, we need to consider if there's any further bony going on, any wear and tear type stuff, whether we've got any disc bulges, we've got any other pathologies going on into the back. If those stretches don't free it off, then it may be that everything is just too tight, too stiff, and some mobilisation techniques, manipulation techniques can be very helpful to get from your chartered physiotherapist to get everything moving in there. Just give it that extra bit of oomph effectively to get things freed off, and then the exercises can become much more effective from that. Equally, the soft tissues can be very stubborn. Everything's been stiff for a long period of time. The muscles, the ligaments, the tendons around there all get very stiff, and again they can need mobilising and stretching out. And then finally, if it keeps on recurring and it's something you've had for a long time, we need to look at things a little bit more globally in terms of the way in which you move, the way in which you're running, the way in which you're exercising, the way in which you're walking, even sleeping, and look at other parts. It can just be to do with your upper back and even up into your neck, and biomechanics down through the whole of your legs, which can affect the way in which your back is asked to move. And we need to look at the whole of you to work out the reasons why these things have occurred to begin with, and therefore what to do to fix them in the long term.